Healthcare at CK Birla Group of Hospitals and the Director of MICC at Medica Super Specialty Hospitals, Kolkata. Arindam's contributions extend globally as a former representative of the Asia Pacific Zone on the ESICM Council and the EC member of ISCCM. He is known for the eICU program in 2015, which connected Eastern and Northeastern India, and for launching Medica Home Care Services, which was a groundbreaking initiative in India. Let's speak to Dr. Arindam Kar on something which has not been spoken of that openly, which is end-of-life care. So Dr. Kaur, thank you so much for joining us on BW Healthcare World as a part of the series being organized with CAHO. The conversation that we're having today with you is a very different, very unique one. This is on the end-of-life care. So what do you mean by the end-of-life care, and how is it different from managing other routine treatments as a part of a hospital?
The difference of the end-of-life care, we say, is that that every individual is when they take birth or when they come to the existence, it's an happy news. But if you see, most of the times when they are leaving this world, it's either a little, I would say, messy or sad incidents, or it becomes a sort of errors, parody of errors and everything. So end of life care is to organize that and make the process completely dignified, justifiable, and to that extent, you may also say that if it is happening in the hospital itself, to be also financially also relevant on that part. So this is the end of life care, how you manage that overall process of the person leaving us peacefully, without pain, in a dignified way, with all the respect that the person is going towards the another life, and also not only managing that particular patient, but also managing the family, his or her wishes, the overall the bereavement processes itself. So that's the encompassing everything is the end of life care.
And Dr. Kaur, what are the available palliative care services that we see in India? I'm sure it's going to be similar to what we see across the globe, but for our audience, if you can understand what it is.
One of the components of end of life care is palliation. Palliation means alleviation of pain, discomfort, right? So the pain today, it has got a multiple component or multiple origin of the source of pain itself, right? So what we call is called multimodal approach to pain therapy or the palliation therapy. Here you can have pharmacotherapy, that means giving medicines, whether that medicines, and you have multiple ways to give that medicine, as well as there are different agents also. So it could be opioid based, non-opioid based, non-steroidal, anti-inflammatory drug based. So a lot of different drugs are ketamine based, that means NMDA, anti-NMDA analogs, and all others. So those are different agents, and those agents can be also used in a different way. So either you can give IV, intramuscular, transcutaneous, patches, then tablets, then all others, depending upon the area of disposition. That means if we are doing a palliation in the ICU itself, so we can go in a IV with a what we call patient control analgesia. That means the patient can actually, whenever he or she feels pain, he can take a shot, right? That's called PCA. And and on the other side of the spectrum, if this person is taking the palliation at home itself, in their own environment and surrounded by the relatives and others, but still wants a palliation, deserves a palliation, then you can have a transdermal patch. So because you don't get all the sophisticated equipments over there, and still the delivery of the pain medicines can be much sort of useful. So this is an A. In India, right at this moment, palliative care medicine is now a specialized branch. This branch normally comes from people who are very specifically trained in handling pain medications, basically anesthesiology and critical care medicine. Also, there is a component of psychotherapy in palliation, right? So some of the advanced care psychologists, social workers, pharmacologists, and also they have started to take training in the palliative medicine. So if you see, it's a teamwork of a clinician, psychologist, pharmacologist, because the dispensing of medicines is very important, clinical nursing, of course, social worker, and administrator. So all these people eventually comprise a palliative care medicine team.
And sir, what is the legal validity of advanced medical directives or do not resuscitate DNR orders in India that we see?
Very, I would say, interesting question. So before I answer that, I would like to make people understand that what is this DNR or advanced directives on that. So this is obviously the origin of this concept has come from developed countries, that you can make your wishes beforehand. That how would you like to, in a situation where you are not competent enough to take a decision of your own life, or the decisions of your own health, right? You are sort of incapacitated, or you are unconscious for some medical reasons, and and some of the other person, next of kin, or a substitute person is taking decision on your behalf. So if there is an expressed will that this is what you wish to have taken a decision, then in that case, the person who is taking a decision on your behalf would have a guidance that how it should be done, or what you would have asked for. So that you can do, and that you can actually legally notify, and that's we call advanced directives or living will. In Western countries, particularly Scandinavian countries, UK, US, right, you can actually uh, sort of write a complete detailed advanced medical directives, notify it, and it becomes almost a binding to the physician or the healthcare authority to follow that to the T, right? But still, it is diktat, sort of an ethical decorum on the physician itself, that we still discuss uh, with the family itself, right? So that's what we call a name. And DNR is a part of that. DNR means do not resuscitate. It's a part of advanced medical directives. In advanced medical directives, you can have multiple components. For example, one component could be, okay, if I have an end stage cancer, would I take chemotherapy or not? So you can opt out that I don't wish to take chemotherapy if it is a very advanced stage for cancer itself, right? So that those could be different components. One of the components is do not resuscitate. That means if there is a situation where I have the person has suffered a cardiac arrest itself, the heart has stopped, right? So I don't want any resuscitation, that means a CPR to happen. Or if the kidneys fail, I don't want to initiate a dialysis itself. So something of that sort, where you can very specify that I don't want my organ to be resuscitated. I would love to prefer to go without an extension of my suffering itself. So these are the things. Regarding the legal standing in India itself, there is no express law where you can actually make a name, but you still can do it, right? And certain 2 3 judgments from High Court and Supreme Court, in fact, last in 2023, a very clear verdict has been given that advanced medical directives is a accepted form of a certain individual's freedom of express, or a sort of freedom of will of his own life itself. So you can accept it. But in Indian context, you see what happens. In Western countries, it is very difficult, practically speaking, to get a relative, to find out a relative who will take a decision on your behalf. And here it is in completely opposite scenario, right? You have 10 people who are in, most of the times they are not in conjunction or not in unanimity on a decision making, right? So in those situations, an advanced directives actually could help, and it is also legally standing. But still, I would say, even if it is completely legalized by a law passed in the parliament or something others, which may happen in coming days, but still there would be always a clause that it has to be validated, verified, and agreed upon by the next of kin. That's how the medicine should work. Okay, so what would it help? The advance directive would help the relatives to take a decision, for us also to tell the relatives, okay, your father would have liked to have this one. This is his will, this is his wish that he has expressed explicitly as well as in writing. So that's the importance and legality of the advanced medical directive.
But Dr. Kaur, it's a thought comes into my mind. It's very interesting that when you're looking at DNR, and the doctor feels that he could save a life, what's the ethical versus legal dilemma that a doctor goes through? I mean, when you know that the person has a life that can be given, versus versus a DNR saying that if I have a heart attack or a cardiac failure, do not DNR should be enforced.
It is again in good faith that if we are sure that this person has a reversible situation without any end stage disease process, right? For example, it's not a end stage cancer, it's not a sort of a person suffering from liver failure or heart failure for years, and this is not a natural progression of the disease process towards the end, right? So for if a 50-year-old has somehow put an advanced medical directives and suffered a cardiac arrest due to an MI, and if I know that if I open up that in an angioplasty, this guy can have another 15-20 years of fruitful life, right? So in that case, it is our moral, clinical, ethical, maybe to that extent a legal obligation to overrule that advance or directives or a DNR directive. How we do that? We can have a very detailed discussion with the next of kin or substituted judgment. Next of kin in Indian context, it is always the spouse first, and in absence of spouse, it could be the parents or the siblings itself. So if the patient is not in a situation to discuss or understand, or is completely unconscious, incapacitated, we will definitely take this up to the next of kin, and we have all the rights to and also ethical obligation to overrule that, or to make people understand that it is in their good uh, sort of faith, or in their goodness, that we can revert to the to resuscitation process itself.
And Dr. Kaur, what are some of the options for home-based versus facility-based care? Because many a times the caregivers or the patient's family is unable to decide what should they go in for. Should it be a home-based versus a facility-based care, palliative care?
This is a trick situation. I would definitely agree on that, because not every institution are well equipped. India is sort of uh, in one side you have some of the most advanced care institutions, and then you have uh, all the basic institutions too, where the concept of palliation unfortunately have not trickled in. And this is very particularly true, with all due respect, because we all have trained in the public sector itself. We have done our basic training in the public sector itself. The concept of palliation is not very. On the other hand, in the domiciliary setup, the problem happens with that there is very few number of palliative care specialists. many of the doctors are not completely aware of the process of palliation. And one very practical problem is availability of the opioid-based medicines at the home setup. It's particularly even the IV or the oral formulations. The prescriptions become a difficulty, and also to have a constant monitoring at home and all others uh, becomes a problem. But if you say so, if there's a end of life care decision has been taken and to be implemented, and also the only intent of the therapy is to respect the person's wish, to allow him to spend his end moments with dignity with the family members in the familiarity of his own space, right? Then obviously the domiciliary based palliation medicine is the best one. But to arrange for this is really a technical challenge. Even in the hospital, I would say, sir, that in the hospital at times it is difficult to implement palliation in a ward based setup. Think of, you are in a ward, right? There are 10 patients along with you, right? You are in a situation where you are naturally leaving the you're observing an end of life care for a particular patient, right? So what happens, the other patients, right, they may or may not take it in the name. So most of the hospitals who actually follow palliative care medicine, they either perform the palliation in a enclosed space, maybe a single room, or in the ICU itself, and allow the family members to be there throughout the time. So that sort of arrangement that we do have to make. So obviously that it incurs a little bit of additional cost to the patient's family, but that is for the goodness of everyone.
And Dr. Kaur, what are the legal documents that are needed for end of life care decisions? Because at the end of the day, the hospital also needs to be sure of, managing a situation where it does not lead to any legal complications. Are there any specific requirements for a medical power of attorney or advanced directives in India specifically for end of life care decisions?
For palliation, you just need a consenting process, and the consenting can be done by either the patient or the next of kin, or the legal heir, whosoever. And in those days, most of the hospitals, now that those private setups and even the public setups are are following the accreditation process, whether it's NABH or JCI, both of these accreditation bodies have very prescribed formats on the consent forms. So you can pretty well follow that form, and they are legally binding. You do not need legal a lawyer and all that. Problem happens in certain uh, sort of context, whether it is ethical, legal, or at times emotional. One is that if there is not an unanimity amongst the family members, right? So what happens? There are three son, one daughter, and everybody has a different opinion itself. In legal terms, let me explain you. The eldest son, it becomes the next of kin of the surrogate itself. But do you, in that sense, negate or overrule other people's sentiment, emotion, or their opinion? No. So, as a physician, you always want that in multiple meetings and all others, you try to come up with an unanimous decision from the family members itself, even if you have an advanced directives on others. So that's the trick of the clinical medicine and the palliative medicine, that not only you take care of the patient, in that process you are explaining the viewpoint of the patient as well as yours to the family members, and all of you are coming to a consensus itself. Regarding advanced directives, yes, it has to be a legal document, but again I am reiterating, in Indian context, an advanced directives is actually a directive, is not a completely binding. That means you just cannot ignore, overrule any family member's opinion just because you have a signed a name. Okay, you can push forward your agenda, you can refer, you can fall back on the document, you can make people understand or very strongly advocate about it. But whether you can overrule, I am not advising that. I would rather say that take people into your confidence, let the family members also agree to the advance directive proposition. Yes, where there is a definite point of recovery for the patient, you can overrule. You are clinically, ethically, and legally certified to overrule an advance directives, and that you can take in good faith.
And Dr. Kaur, what are the costs associated with the end of life care or palliative care? Are there financial assistance programs that are offered to families who are, who need to go through this particular process? Or does the insurance options that help cover these costs, are these there?
Bereavement process, yes, Western concept where you can actually save money for your funeral services, bereavement services. A couple of companies have started this in India. I know one of my very good friend. She has actually way back, almost 10 years back, launched the first bereavement service for all the different religions itself in India itself. That was the first uh, uh, qualified company to start a bereavement services. Indian context, insurance is yet to sort of acknowledge palliation, bereavement services, domiciliary services fully under the purview of insurance itself. But we are pushing them. We are in discussion. They are modifying themselves. But if you say so, right at this moment, I'm reasonably sure none of them are offering you on sort of a. But if this palliation services is being conducted in the institution itself, and we are putting them into the overall medical bill, right? The insurance are actually reimbursing that part. But whether, if you ask me, that whether advanced palliation setup is being done in the home, in the domiciliary system, and then we are asking for it, it is difficult. Out of certain uh, uh, institutions like, if I name them, like MediAssist, HDFC, Argo, and others, they have started. They have started private insurances. They have started now to give a coverage for palliation. That's very specifically they have started.
And have you ever seen that when a patient needs to be let go and is a terminal case, palliative care needs to be given, the family looks at expenses in a very different manner. They feel like, why should I be spending so much of money? In such kind of cases, are there any government schemes that are there, or are there any non-profit organizations that you have seen who come forward for supporting such kind of cases uh, and reduce the families struggling with financial burdens?
है कोई ऐसा? I I have not come across that. I have been practicing almost now 26 years in ICU, and I've also have led the Indian Society of Critical Care Medicine. I'm still in their executive council and the college. With all my experiences, I have not seen anyone who is sort of, yes, there are support groups, there are volunteers who support you during this process, be it you're as a psychiatrist, as a psychology worker, as a social worker, as a support team. Even I have seen people from different colleges, pharma colleges or nursing colleges, come to give voluntary support and others. But financial support from some non-profit organizations or government schemes, I'm not aware of, sir.
Got it.
likely there isn't any.
Right. And Dr. Kaur, since you spoke about psychiatry and psychological, what are the psychological and emotional support which is available for the patient and their family? Are there counseling or support groups available to help them cope with the emotional aspects as a part of the hospital?
Yes, sir. This is now almost a mandate for a hospital with a very advanced care, because with advanced care we will also have this group of patients who would require active palliation, right? For example, if you have a high-end transplant program or a very advanced oncology program, right? So there would be stories of success and stories of not, I won't say failure, but stories which doesn't have success, right? And in those situations the success would be to have a palliation, to have a very sort of, I would say, effective end of life care, or a very satisfactory end of life care. So in those situations, I think one of the most important aspect would be the psychological management, particularly both the patient and the family relative, because they go through a varying and different magnitude of the grief reaction, right? So some people are in a denial phase, some people in an acceptance phase, some people are angry, some people are desperate, and in desperate situations you take a lot of measures which are not appropriate in that part. And also the patient, many of these patients are completely awake, very much in pain, very much in physical and mental pain, and the slow process of uh, and when they realize that the time is limited, and even that the process is agonizingly slow, and as in India we are not allowed to actively sort of enhance the process itself, actively expedite the process itself. So sometimes the overall process can be painfully sort of a long process, right? So in those situations, it is very actively required for the patients to undergo counseling, psychological support, at least at times talking to them. In comparison, in contrast to the developed countries, right, where the constant counseling and psychological support is much more advanced, right? Here, I think two things. One is a paucity of the trained psychologist in palliation. We don't get that much of people around. And also, here, as a blessing, I would say it's a blessing, we have too many family members, right? And if we can really guide them through the palliation process, and we can sort of quickly put them into the overall the understanding of the process, they are one of the best people who can comfort the patient itself, right? Because you see, in at the end of life, think of a patient who doesn't know a counselor, who doesn't know the doctor itself. He can be more effectively comforted by a person whom with he has spent his entire life. So that's sort of we call the proxy counselors or a proxy psychologist at that point.
And sir, my last question to you is,
Yes, sir.
uh, what are the options for grief support? When a patient passes away, how do you manage the grieving process of the family? Uh, and it's not necessarily, that the family has had enough time to process the patient being let go. So are there any grief counselors that you have in a hospital, or are there any support groups that you work with?
Sir, two, three things have happened. One is that there is now, for example, our institution in Mumbai, we have a complete bereavement process and even a bereavement officer who takes care of all the formalities, all the funeral processes, preparation for the funeral processes, and all others, embalming. Even if it is patient, we get patients from all over India to sending the deceased person to their destination and all others. So all these technicalities, legalities and others. But also we take care of the emotional component of the family members who are recovering from the overall the detachment of their family member itself. One thing is that this is a continuation of a process, right? The same counselor or the psychologist actually counsels, keep in contact even after they have gone home, even they have left the hospital. There are follow-up phone calls, and if required, they can come back, right? So there are certain processes that we follow where there can be follow-up counseling for the patient's family members, right? The patient who has passed away. And also, we have very recently, India has started the patient advocacy group or the patient support groups itself. And in those groups, there are a lot of inputs from the counselors and the psychologists itself. And there are subgroups of patients who are grieving from recent loss itself. And they have a self-help group, they support each other, they meet each other, and now the meetings are quite easier to be done in a virtual format, right? So those things are picking up. So sir, in a couple of years, I think we will and also with the westernization of our family, with the family size, particularly the nuclear family size, we will badly need it. We will require a lot of self-help groups, advocacy groups, patient support groups, counselors, help from others. And we need to take, I would say, we need to face this issue of death, of bereavement, of or what we call a dying process with dignity, that and without any discomfort, without any pain. So every man or woman or a human being rather has the right to end his life, his or her life, with proper dignity, with proper care, with his own choice, and in the presence of the family members, and without any, absolutely without any pain. I always train my or teach my students, juniors and colleagues that if someone is experiencing pain, particularly in a hospital environment, then this is an utter failure for an acute medicine person. For an ICU guy or an anesthesiologist, it is a shame that a person is complaining of pain. So be it your post-operative or be it in your advanced palliation situations, the person in an hospital should not experience any sort of pain, discomfort, or any inconvenience. So that's the overall concept of the palliation.
I have one more question that comes into our mind. I'm very tempted to ask you this.
Right,
What
sir.
what have you observed in your experience? And this is very different conversation that we've been having today, because not typically that we talk about death and preparing for death. About the religious sentiments and social sentiments of people in India. People come from different religious backgrounds. Has it ever created a challenge in terms of choosing to give palliative care or deciding how to give palliative care?
Tough question. And but the question is not tough. How to put it, the answer could be tough. Sir, you see, majority of our patients is obviously comes from the obviously the majority religion, right? And most of the religion uh, believe in a concept of afterlife, right? So this process of bereavement has also a connection for the afterlife itself. In my experience over years, I have treated all sort of people from all sort of religious beliefs, right? In certain minority community, to make people understand uh, uh, the concept of palliation is at times difficult. And this is not only related to the religious strong religious belief or understanding, but also at times we have seen that level of education also, or the level of understanding of the process also, uh, sort of it depends on that part also. But normally, the palliation is well accepted amongst the majority, and people who are have got exposure to the developed civilizations. But the good part is that the other religious communities, people, just because of now there is a huge explosion of information itself, or our exposure to the information is so high now, thanks to the internet and the social media and all others. The other communities, or the people from not so well of educational background, or lower middle class, or the lower class people, everyone is now aware of their rights, and also the process of dignified dying. So it's not far off that everyone from every community, from every religious community, every strata of the society will also ask for a good death, a good farewell, a good adieu to the overall process called life. So that's would be our very good ideal situation where everyone is aware and everyone asks for it.
Dr. Kaur, thank you so much for this conversation. It is a tough conversation to have, and a discussion to have.
Right,
But
sir.
I think it is extremely important to bring out the message of creating dignified palliative care so that we give a respectful farewell to someone who's passing away. And I think it is also a good understanding of how the medical part, the legal aspect, the family scenario can all, and the specialists and experts come together to ensure that beyond medicine, beyond doctor, there is a lot of emotional support that can be
Yes, sir.
provided to not just make it easy for the patient or the person passing away, but the family that stays behind. I think it is important uh, both for the patient as well as for the family. Thank you so much for bringing out these insights in terms of helping us understand what palliative care and end of life care is all about. Thank you so much.